Morning, everybody. Thank you so much for joining us for NAMI Maryland's 40th Annual Conference. My name is Brian Trees, and I work with NAMI Maryland. I will be your moderator for the session today. This workshop session is Accessing SSI, SSDI, Busting Myths Through the Maryland SOAR Program, presented by Priya Arakaswamy from the Maryland Behavioral Health Administration and Caroline Mason from Maryland Disability Determination Services. You can read more about our presenters, including their full bios, in the digital conference program on the official conference website. In this workshop, participants will learn how implementing key principles can lead to increased numbers of SSI, SSDI applications. The session aims to debunk the many myths surrounding the benefit process and provide practical tools that can be used when applying for benefits. If this is not the workshop you meant to attend, please click the back button on your browser or click the sessions button on the left-hand side of your screen to return to the full list of workshops we have available. We will be addressing questions at the end of the presentation. If you have any questions as the presentation continues, please post them to the Q&A on the right-hand side of your screen. We will be reviewing questions as they come in, and if something particular is unclear or needs to be expanded, we will ask our presenters after their presentation has concluded. We are pleased to offer closed captioning for this year's conference. Captioning is only available for attendees using a desktop. To enable captioning, please click on the CC icon below the display of our presenters at the bottom of your screen. Once you click the icon, the video displays will become smaller and you will see the captions generated underneath. If you have any comments, concerns, or technical issues, please post them to our chat and our technical assistant will address them accordingly. I'd like to now welcome our presenters for today's workshop, Priya Arakaswamy and Caroline Mason. Thank you so much for joining us today.
Thank you, Brian. Welcome, everybody. We're very happy that you selected our workshop, and we're excited to present this information. Again, my name is Priya. I work for the Behavioral Health Administration. I'm the Assistant Director of Evidence-Based Practices, Housing, and Recovery Supports. And the Maryland SOAR Initiative is one of the programs that falls under my office. And it's my pleasure to be presenting with Caroline from our partner agency. And I'm going to turn it over to Caroline now.
Thank you, Brian, for the nice introduction. Thanks, Priya. Good morning, everybody. My name is Caroline Mason. As Priya said, thank you so much for joining our presentation today. This is one that I've done for several years with NAMI. So I am going to get started talking about a little bit about SSI and SSDI. So if we can go to the next slide. I do work for the Maryland Disability Determination Services, and our agency is the state agency that Social Security contracts with, and we administer the disability portion of their program, and we make the medical determinations of disability claims. The first thing that I'm going to talk about today is supplemental security income and Social Security disability insurance. Supplemental security income is the Title 16 SSI program, and it is a program that is a needs-based program. This is the what we consider the non-medical portion of the determination process, and this information that I'm going to review is handled by the actual Social Security Administration. So what they're looking at is eligibility for SSI for individuals that are filing for disability, and determining if that individual is eligible for SSI. And currently, SSI, if somebody is found eligible, they could receive up to a maximum of benefit of $841. That is for the calendar year 22. I put these numbers together about a week ago, and SSA has actually already put out a new fact sheet for 23. So for anybody that's interested in continuing to get updated information throughout the years, it's very easy to Google SSA fact sheet, based on the calendar year, and you can get the updated information. But what I can tell you is the maximum benefit will be going up to $914 effective 2023. And SSI provides that money to individuals that are disabled, blind, or aged and are low income. And that's a means tested process. And again, that is handled by Social Security. In addition to that benefit, if somebody is found disabled, they are eligible for a Medicaid benefit. When somebody is found eligible for Medicaid, that is an immediate medical assistance as soon as they are found disabled. The final thing is, I mentioned this before, is that this is income and resource based, and they look at income and resources for the individual. If the individual is married, they'll look at the income and resources of a spouse. If it is a child, which is an individual under age 18, they have yet to turn 18 years old, and they are living with a parent or parents, they will look at the income and resources of that parent prior to the child attaining age 18. In addition to resources, they look at secondary homes, secondary cars, those types of things. So let's move on to the next slide, and I'm going to briefly discuss Social Security Disability Insurance. This is SSDI, which is our Title II program, Social Security's Title II program. SSDI provides income based on the work that the individual has done and the taxes they paid into the system. So the earnings are based off of how much an individual has worked and paid into the Social Security system. From a medical benefit, that's the cash benefit. The medical benefit, 2 years after an individual is found disabled, is when they're eligible for Medicare. That is the way the law was written. I get a lot of questions about why that is, and that is just how the law has been written specific to SSDI. If somebody is found disabled and they're eligible for both SSI and SSDI, the good thing there is that they have the Medicaid benefit immediately with the SSI. And currently in 2022, the average amount for disability benefits is about $1,280. So let's move on to the next slide, and I'm going to briefly talk about both SSI and SSDI. So both of these programs are administered by SSA. And as I mentioned before, SSA does all the non-medical eligibility, which has to do with identifying income and resources. And for SSDI, they're determining, has the individual worked long enough, earned enough work credits, paid into the system to be eligible for that insured status that is needed for us to be able to find somebody eligible to even file for SSDI. As I mentioned before, our agency in Maryland, Maryland Disability Determination Services, we're responsible for making the medical determination for all claimants that file that live in Maryland. We do get assistance. We have a high workload right now, and we do get assistance from some states within our region. But it's our job to gather the medical evidence to be able to make that determination. And in addition to medical evidence, we gather vocational evidence, and we also gather functional evidence. So we're giving you that information to kind of talk about why SOAR was created, the problems that were identified with the process with individuals that were experiencing mental health problems and were homeless or at risk for homelessness. So I'm going to turn it over to Priya to talk about the problems, and hopefully the base of SSI, SSDI is helpful moving forward. And I will return to kind of talk about our process here at DDS.
So the problem, if you fill out an application on your own, or if an individual is filling out an application on their own, about only 30% of those applications are typically approved. And if you get a decision that is denied and you decide to appeal it, it can take many years to appeal that. And people understandably give up and they don't file an appeal process. There's also a lack of knowledge of the disability determination process and SSI, SSDI's disability programs. And just the complexity of the process makes it hard for an individual to complete the application on their own, as well as if medical records are just submitted by themselves, they don't address the functional impairments or an individual's inability to work, and they can hide the true extent of a person's disability. So that's where our problems are. And then and we know from experience and data that, gaining SSI, SSDI can help an individual access many things, such as housing. It gives them access to health insurance, as Caroline says, and it also provides them income. It can prevent an individual from experiencing homelessness or end their experience with homelessness, as well as it's an ability to promote an individual with a disability's recovery. So that's some reasons why it's important. I'm going to turn it back over to Caroline.
Okay. All right. So now I'm going to really talk about some of the technical aspects of what we do here at the Disability Determination Services. I'm going to start with talking about the definition of disability, because Social Security's definition is different than other organizations that have definitions for disability. There's 3 key parts to this definition, and it talks about the inability to engage in any substantial gainful activity. We refer to that as SGA. So when we talk about substantial gainful activity, that is a concept of work. So it's a person's inability to work, and the SGA is like the dollars that they are earning. So it's the inability to work and earn a certain threshold of money based on that work. And right now in 2022, SGA is considered $1,350. That actually is also going up to, give me just a second, I have my cheat sheet over. That's going up to $1,470 in 2023. So the inability to engage in work at a threshold above $1,350. So anybody earning under that amount is eligible to file. But in addition to that, we have to look for what we call a medically determinable impairment. So the reason they're unable to obtain that level of work is because of their medically determinable impairment. The third portion of this is the durational aspect of the disability. So the disability has to be expected to result in death, or it has to have already lasted for 12 continuous months, or be expected to last for 12 continuous months. So again, 3 key parts: the ability to engage in work at a threshold below 1350 is that inability to do that because of a medically determinable impairment, and then the durational requirements. So that's Social Security's specific definition of disability. So now I'm going to talk about our sequential evaluation process, which is on the next slide. And that's the path that we use here to basically make the determination. And one of the things that I always share with folks when I'm talking about the process that we follow here, everything that we do here at the DDS is very policy driven. We have very specific criteria that we have to follow from SSA. This is a national program, but we follow the same guidance that is provided across the country. And we follow the sequential evaluation process. So I just mentioned in the definition that we talk about engaging in SGA. So if at any time, once we here at the Maryland DDS, a claimant have the case here and we're adjudicating the claim, if the claimant returns to work or increases the amount of work that they're already doing and it goes above that SGA threshold, we may have to return that disability claim to the field office, because that is part of the definition. So there are times when at step 1 of sequential evaluation, if the person goes above the 1350, that we would return the claim to SSA, and it would be a non-medical determination. because we're not returning the case because of the medical condition. We're returning it because of the SGA threshold. So that's step one. Now, usually that's figured out by SSA, and most people are under SGA. However, there are times that happens, but that is not the norm. So usually we're looking at SGA, and a lot of times, like if we reach out to a claimant, they might tell us they've returned to work, and that's where it would kind of come into play, that we would look at the work history and work with the claimant and work with SSA to determine where they are. If they're below SGA the entire time we're adjudicating the claim, which is the norm, as I said, we would then jump to step two, a sequential evaluation. Now, from step one to step two, when we first get the case, to more determining, is the impairment severe? We've done a lot of outreach. We've looked at the application that's been filed. We've looked at the sources that have been identified, the allegations that are there. We're making sure that the medical sources, the treatment sources that are there are consistent with the allegations. Oftentimes we might see a primary care physician and the individual lists medical conditions such as diabetes or a stroke, but they might also list other mental health problems, but there aren't any mental health providers listed, or vice versa. So, day one, we're going to try to kind of connect a lot of the pieces of the puzzle and make it a more clear picture on the next steps that we want to take, because we want to provide the best quality determination. So knowing treatment, knowing sources for all of their conditions is really helpful for us right off the bat. So when we get to impairment severity, we've started gathering medical records. We've started gathering other types of functional information with regards to activities of daily living. And we're making a determination based on that information, how severe or not severe this individual's condition is. I'm going to talk a little bit more about functioning later, but that really comes into play when we're talking about severity. An individual might have a medical condition, but if their condition is treated, they're in regular treatment, medicated, not medicated, but they're functional, we may, in those instances, indicate that although they have this medical condition, it's not significantly limiting their overall health, and they're functioning on a day-to-day basis. So at that point, we could make a determination that although they have this condition, their impairment is not severe. If we do that at step two of sequential evaluation, we would make a medical determination to deny the individual. If we make a determination of what we say is more than not severe, so they have these medical conditions and they have significant medical problems, they're significant functional limitations. At step two of sequential evaluation, we're going to look at that and say, this is not severe, it's more than not severe. We need to take a more in-depth look at it. So at that point of making that determination that it's more than not severe, we're going to jump to step three of sequential evaluation. Now, again, we have medical records, we have other functional information, and we might even have vocational information if the individual has worked or not. But at step three of sequential evaluation, we're really looking at, does the impairment meet or equal the listings? Going back to the policy concept that I shared before, Social Security provides very specific criteria for medical conditions, and that information is available. I believe we have links at the end of the program here today specific to that, but it's broken down by physical impairments and mental health impairments. It's also broken down by adults and children. And again, an adult is anybody that is 18 or above. So we look at what the medical condition is, and we look at the specific listings and determine, is the medical criteria there to support this disability claim? If somebody meets the medical criteria that's outlined in the listings that Social Security has provided, we could make a determination that they meet that medical listing. And at that point, we could make a determination to find that person disabled. When we talk about equaling the criteria, it may not meet the exact intent of the listing, but the individual could have other medical conditions that are so severe that impact, again, their medical condition as well as their functioning, we could say that that individual equals the intent of the listing that's provided by SSA. So at step 3, if we determine that they meet or equal, it is where we can first allow them for disability. However, if we're not able to meet or equal them, we start looking at work. And again, this is for anybody. This sequential evaluation process is for adults only, not for children. So we're looking at their work. Every individual, when they file for disability, is sent a vocational history, and it asks for 15 years of work history. The reason that we are required to do that is when we get to step 4 of sequential evaluation, it's our job to determine does this individual retain skills to return to their past work? And we look at the work history form that they filled out, and we also create a residual functional capacity. We have in-house physicians and psychologists that work with us to help us evaluate the claimant's functioning based on their medical conditions. So when I talk about residual functional capacity, so from a physical aspect, we look at how much can they lift, carry, stand, walk, see, use their hands, use their legs. From a mental health capacity, we look at their ability to attend, concentrate, sustain, independence, initiate, overall skills that all of us would need to perform work activities day in and day out. So we create this residual functional capacity, and we have to identify what we call past relevant work. And past relevant work is any work that the individual has done long enough to learn. And all jobs have specific criteria of how long they have to learn it. My job, they say, disability examiners here, takes about 2 years. So if I was working here and had only done the job for a year and listed that on a disability application, it could not be considered past relevant work because I didn't do it for 2 years. I didn't perform the job long enough to learn the job and take those skill sets to be able to return to that type of work. So step 4 of sequential evaluation, if we are unable to determine that they can't perform past relevant work, we would go to step 5 of sequential evaluation. But if we do identify past relevant work that they're able to perform based on the residual functional capacity, they would be denied at step 4 of sequential evaluation. So assuming we are unable to identify past relevant work, we're going to jump to step 5 of sequential evaluation. Before I get to step 5, my apologies. If somebody has never worked before, we are not going to look at step 4. We're going to just automatically jump to step 5 of sequential evaluation. So at step 5, we're still looking at work, but we're looking at different things now because we're going to look at other work. So we can't send them back to their past work, but how old is the individual? What education do they have? What skill sets do they have from their past work, if they do have past work? Do they have any transferable skills? And again, looking at this residual functional capacities that we've built based on their medical conditions and their functioning, are we able to identify other work that they could perform? And that's what we're tasked to do, is determine if they're able to perform other work. If we are able to identify other work, at least 3 jobs that they can perform, they would be denied at step 5 of sequential evaluation. If we are unable to identify 3 jobs, then they would be found disabled at step 5 of sequential evaluation. So that, in a nutshell, is our sequential evaluation process. So I want to move to the next slide, and I want to talk a little more in depth about our mental impairment listings. So this is in our Blue Book. Again, this is online on SSA's website, and it's also on the PRA website with SOAR. These are all the mental impairments that we look at under the very specific listings. So what I'm going to do is I'm going to walk through the specific criteria that I mentioned previously with regard to listings. So if we can go to the next slide, I'm going to kind of talk about the structure of the listings. And the way they're structured is by different criteria. So the A criteria is medical criteria. That is the criteria that has to be present for us to be able to determine that the medical condition is significantly impacting their functioning, impacting themselves. But then we look at the B criteria. The B criteria is functional criteria. We get that from activities of daily living. And this again is kind of going back to what Priya was talking about. This is really where we struggle sometimes and where one of the biggest problems is, because traditional medical records do not include a lot of information about functioning. So this is what we are really stressing today, and this is one of the things that we really stress in the overall SOAR process, which really helps put together a very comprehensive picture and completes that whole puzzle of the claimant. So we have a very good picture of that individual, their conditions, and how they're functioning. So the B criteria is really key, and that is assessed on a 5-point rating scale from none to extreme. And I'm going to talk about that in a little more detail in a few minutes. And then we have a C criteria, which is used to evaluate very serious and persistent mental disorders. So those are individuals that might have a medical condition that, despite regular treatment, whether it's they might be in a regular day program or a rehab program, and despite that continued treatment, even regular treatment with a primary psychiatrist or mental health provider, that they still really struggle and need a lot of support. So let's go to the next slide, and I'm going to share an extract from our medical listings, and this is specific to our depressive and bipolar related disorders. So as you can see, this says depressive disorder, and we have to have 5 or more of the following criteria in the medical records. And going back to that definition, we have to have the longitudinal history. If we have one report of that, that's helpful, but we need information to show that it is a persistent problem. It's been going on, because we've got to be able to either go back and fill in the past 12 months or fill in the months that we have available and make the determination, how severe is this and is it expected to continue for 12 months. But if we can identify 5 of these criteria on a longitudinal basis, the individual would meet the A criteria for the listings. The A criteria alone is not sufficient for mental health listings to find someone disabled. So jumping down to the next slide, we have the B criteria. These are the 4 areas of functional information. I'm not going to go through these because we're limited on time today, but what we do is we really look at these specific areas. The other thing that I will share is SSA's website. Under the listings area, there's a lot of detail about functioning and what we look for, and it's really helpful to those that work within the SOAR program. But these are the 4 areas where we do that 5-point rating scale. How significant is it? Is there no limitation, or is there an extreme limitation? Specific to the B criteria, if we can find one area that's extreme or 2 that are severe, we could find that individual meeting the B criteria. Several of our listings show that the A and B criteria together would give us the ability to make a medical determination that that person is found disabled. And then finally, the C criteria goes back to that serious and persistent medical condition. And as I said before, it's continued medical treatment. We have to see a pretty consistent period of 2 years of regular treatment. And despite that treatment, whether they're in a really structured program or just, as I said before, going to a regular provider, there's really no significant transition to moving away from dependence. They might need a lot of assistance with their regular daily activities. So that's information that is really helpful. Just to recap, the 5 criteria that we saw, if we can meet the A criteria, and then the functional, if we have 1 extreme or 2 marks, we have the B criteria. And the A criteria and the B criteria together, we could find someone disabled in several of the mental impairments that we showed in the beginning. Others allow the C criteria. So for more chronic and persistent conditions, we could allow someone solely on the C criteria to be able to make that determination. So really quickly, we have a little bit of information about functional information. I'm not going to go into much detail. We have about 15 minutes left, but This is really important. If you're working with somebody and helping them, whether it's your own disability claim, a family member, you're a case manager working with someone, the functioning information is really the key, because that's what makes every individual different. You might be working with or experiencing symptoms that a lot of other people might be experiencing, but how the individual functions, and what we say is impact of symptoms. How do those symptoms impact the individual's ability to take care of themselves, basic needs, to possibly even take care of others? Depending on where we are in our life, we might have responsibilities for other individuals, whether it's our own children, whether it's our parents. Are we able to take on those responsibilities, and how significant are the limitations? And painting that picture is really one of the things that SOAR is focused on and dedicated to. So getting information from family members, from third parties. We've reached out to providers themselves and kind of asked them to provide additional information specific to the individual's functioning. How they function in different settings is really, really helpful. Some folks function a lot better in unstructured, they really struggle. That is telling. That is very indicative of how the symptoms are impacting their ability to function in that, without that direct structure or even direct support. Providing as many details as possible with regards to functioning is very helpful to us. So on the next slide, we've provided just an example of the functional impairment, and it talks about an individual who struggles with short-term memory, forgetting names, dates, places. And then it goes into detail. The caseworker must keep a calendar. My apologies. I do not have the ability to turn my phone off in my office. That the caseworker has to keep a calendar for them. They have to reteach them how to track their days, maybe crossing off the days. They still get confused on what day it is. So because of that symptom of the memory, how's it impacting them? They can't remember appointments. Sometimes individuals will call providers multiple times a day because they may not have remembered whether they have the appointment or whether they actually called them before. They forget simple directions. They forget to take their medication, which is needed to help them. So hopefully what you're getting from this is that we're not just saying Mr. Doe or Miss Doe has short-term memory problems. We're identifying what the symptom is. We're identifying the limitations that the symptom causes, and then how that impacts their functioning on a day-to-day basis. So that's just a brief example of one area of functional limitations, and kind of expanding on how the individual functions. So I'm going to turn it back over to Priya so she can cover some more information, and then we'll take questions at the end.
Thank you, Karen. So what is SOAR? SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And SOAR aims to help states and communities increase their access to SSI and SSDI benefits for individuals who are homeless or at risk of homelessness and diagnosed with a severe mental illness. It's a national program that's sponsored by SAMHSA, with programs in all 50 states and Washington, D.C. If you're looking at different states' programs, though, just be reminded that each state's program is going to be implemented differently based on how that state decided to implement the program. It focuses on increasing provider role and engagement through the application process. And we aim to serve the individuals who are most vulnerable and find it difficult to navigate this very complex process, who might not have been able to do it on their own, or may not have family, friends, or other support systems who can support them through the process, and who may need additional support to help them apply for benefits. We're also focusing on obtaining benefits as an aid to recovery, not the end in itself. Getting benefits, as I said prior, it can help with a whole range of services such as housing, accessing medical insurance, And it can also, help with supported employment and accessing safety nets through these programs. It's a part of the recovery process to meet an individual's life goals. All right. So how is this model different? So in a regular application process, an individual may have called, they may show up at Social Security, they may have an appointment if they qualify, and they would provide all the information to SSA, and the information would be very lengthy. They would have to know about their past work history. They would know about their treatment, as Caroline said, that, all of the treatment history, and then they would wait to hear from SSA and DDS to request more information, and then they'll have to wait for a decision. So with SOAR, our SOAR trained case managers, they take an active role in the process. We want to make sure that we paint that picture, as Caroline said, and make that case very robust, and making sure that we're collecting all of the information. That SOAR case manager is going to talk to the applicant. We're going to hear their story. We're going to ask them, what does a good day look like? What does that bad day look like? What happened in the past? How is it that you're here today? And really try to get that holistic picture that medical records is not going to show. As Caroline said, with permission from the applicant, we're going to talk to family members, we're going to talk to current providers, and other support system to help paint that picture of the individual. We are also going to get all of those medical records. And for those individuals who may be experiencing homelessness and might have some gaps in those medical records, we're going to look at the medical records to see if we can identify other providers, as it's important to show that continuation of the medical disability. So that our SOAR trained case managers, they do a lot of detective work to make sure they're presenting all of the information to DDS. And then they're going to, with all of that information that they gathered, produce a document that we call Medical Summary Report, or MSR. And that MSR is going to provide a narrative with all of the information in one place that's concise and focuses on functional information. And then we are going to try to get that signed by a relevant treatment provider so that can become medical evidence. We also are our managers are really focused on that initial application, and we want to make sure that we're getting it right the first time. As we said before, appeal process takes a long time, and we want to avoid the appeal process at all costs. So we don't want to add any more time on the individual's application process, and we don't want to cause the individual more stress, not just in waiting, but to tell your story over again. So we want to get it right the first time. We also train our case managers. There's a training process. It's online and in virtual as well. And we have SOAR case managers that can only submit SOAR cases. They've been trained. We make sure that they have high quality applications. So it is a robust training process. And then we also offer technical assistance for those SOAR trained case managers. And since we work with the individuals that are incredibly vulnerable in our cases can be triaged through the SOAR process. And once they're identified as SOAR, they get assigned to DDS, who then triages it to an examiner who can undertake that SOAR case, and they can start working on those cases immediately. And because we've done a lot of the pre-work with getting medical records, creating that MSR, they can, it gets submitted, as I said, to the examiner straight away. In the regular application, as Caroline mentioned, they get all of those medical records and look at them, and they reach out for those medical records. With all of that information being provided upfront in the SOAR process, this allows the cases to be adjudicated in a timely manner and decreases some of those process times. We also look at our data. We ask for SOAR case managers to turn in on every case, turn in like the approval rates, how long did it take them to process that, and we monitor that information very closely. We know this is a complex process, and even with training and support that we can get it wrong sometimes. So we work really closely with our partners at SSA and DDS to make sure that we're monitoring it, the process, and if we need to make any adjustments, that we're making that adjustments to make sure the process is solid. And then we also have some funded positions who take referrals for SOAR cases, and that's all that they work on is SOAR cases. So in Maryland, SOAR, we have SOAR trained providers in all counties and Baltimore City. Each SOAR jurisdiction has what we call the local SOAR lead, and that person coordinates work groups with the individuals that are trained in their jurisdiction. They are the liaison with DDS, and then they help troubleshoot any issues that may arise. As I mentioned before, we do have some funded SOAR positions, and those individuals can be found in Baltimore City, Anne Arundel, Baltimore County, Frederick County, Montgomery County, and Prince George's County. We also have an individual that serves the Midshore region, so that covers Kent, Dorchester, Queen Anne's, Talbot, and did I mention Caroline? I think I mentioned that twice. And then Southern Maryland, we have Calvert, Charles, and St. Mary's. And then through the state, through the Behavioral Health Administration, and with our partnership with DDS, we offer technical ongoing assistance and support. We are very lucky here in Maryland. We have an excellent program. I might be a little biased, but that's okay. We have, as SOAR was implemented, we've served over, we had 2,100 and over SOAR cases, applications that were adjudicated with an overall approval rate of 83%. As you can see, that's much higher than the statistic I provided earlier of 30%. The average approval rate for initial SOAR claims is 86%, and the average processing time is about 80 days. Maryland has the third highest approval rate in the country. And many of our individuals actually have had claims that were denied prior to using SOAR. So if you guys are working with an individual and you guys may think that they're eligible for SOAR, this is the SOAR eligibility criteria. You must be 18 years or older for the program. Must be homeless or at risk of homelessness. Now, our definitions of a homelessness and at risk of homelessness are broad. So homeless would be literally homeless, living on the streets, an individual who may be at a shelter. They may be staying at a place that's not fit for human habitation. At risk of homelessness, that's a little as well broader. We're looking at individual who may not be able to maintain that housing without supports. And we're looking at cases by case by case. So if you have questions, you can reach out to see if the individual's eligible with the homeless or risk of homelessness. That's something our SOAR lead individuals would be able to help you guys with. And then they must have a severe mental health issue that prevents an individual from working above SGA, as Caroline said prior. And those people may be able to work part-time, but it's, working below that SGA due to their mental illness and impacting their ability to work. And then generally we don't have individuals that are at the hearing level already. We can work with individuals who at the initial claims or at reconsideration where DDS would relook at their case. We can support those levels, but at the hearing level, it's we recommend that the individual does have an attorney, as those are much more legal process that we don't have the expertise for. And then the person needs to consent to work with the SOAR trained provider. And then I know Caroline had made mention of lots of resources. So this is just the list of resources that we recommend that you guys look at. SSA website, they have highlights as they'll put fact sheets out. So all of that information is nicely, clearly on this website. So I would take a look at that for more information. Then the SSA Blue Book, as Caroline mentioned, with the is very helpful. Just if you guys are Googling it, make sure you guys are putting SSA Blue Book, as there are other Blue Books out there. And then the SOAR National TA Center, they provide technical assistance to all of our SOAR leads, to us, so they also have a wealth of information regarding SOAR. And then the SSA office locator, that's just good to know where your Social Security office is and where to go in your area. And I think, Caroline, I kind of blew through all of that information. This is our contact information. And for like SOAR inquiries, if you're looking to see who could assist you in a certain jurisdiction, if you guys can email our BHA SOAR at maryland.gov email, and myself or my staff member Wayne will be able to assist. We are currently in the process of hiring a SOAR manager. Individuals may be familiar with our previous SOAR director, Caroline Bullis, who moved to a different position. So we are covering that position. But we have great support. So you guys have questions, you guys can email it there. If you're a case manager and you're interested in being trained, you guys can also email that email address, and we'll be able to point you in the right direction and get you connected to your local SOAR leads, who will also be able to assist.
Okay. Thank you for such a great presentation, and we'd like to now open it up to question and answer. Remember that on the upper right of your screen, there's a Q&A tab. If you want to post your question there, then we can address it. So the first question is, how do you make a referral to your program?
So it will depend on which jurisdiction you are in and which county. So as I said, there are SOAR leads, and SOAR leads usually take the referrals for the programs. So for some of the programs, for some of the counties that don't have a paid, that we don't fund a position, those counties, the SOAR trained case manager, they work with the individuals that are currently in their program. So if Bridget, if you email the SOAR inquiries email, we'll be able to connect you depending on where you are in the state.
Okay. The next question, the person is asking, how does my son who has schizophrenia apply to get reassessed? He has been on SSI, SSDI.
So I can help with that. So with the statement, he has been on SSI, SSDI, I don't know if I should assume this individual received benefits in the past, or they're currently getting benefits, and they're wondering if the case is going to come up for review. So I'll cover both. If somebody is currently receiving benefits, once we make the medical determination that finds somebody eligible, we set what's called a diary date. And based on that diary date, the local Social Security field office will reach out to the individual claimant, or if they are a child, the parent, guardian, or if they're an adult that has a third party, they'll also reach out to the claimant and the third party, basically indicating that their case is up for review. They would have to do an application for what's called a continuing disability review. If it's somebody who previously was receiving benefits and they're not currently, you would have to start the process at the beginning, go to the local field office, file a new disability claim, and start there. I hope that helps. And if it's the latter and there's support needed, you could also reach out to the bha.soar@maryland.gov to get connected with somebody to possibly refer the claim to. If it's an existing claim, my name and email address and phone number are on there. You can contact me and I can look at the status of the existing claim. If specific to this question that it's somebody's son, I wouldn't be able to give information if it's an adult and the parent is not listed as a third party. So just to kind of cover all the bases there. I hope that helped answer your question.
Okay, it looks like I'm not seeing any other questions at this point, but if we didn't get to, or if you have a question that we didn't address, please send your questions and the name of the session that you attended to connection@namimaryland.org, or submit your question at the end of the event evaluation later this afternoon. That's all the time we have for now, so thank you to Priya and Caroline for your presentation and your time. It was really great. At the end of the conference today, you'll receive a link for an evaluation survey. If you'd like